This video will cover part 1 of Chapter 8, Biopsychology, Neuropsychology, and Cognitive Neuropsychology for PSY 120 Careers in Psychology, Neuroscience, and Human Development. Up until this point, we've covered in our foray into different career paths, largely the areas of psychology that people in general are the most familiar with, things like clinical and counseling psychology and various applications of it, like sport and forensic psychology. Now we're moving into areas that are decidedly more research-based, both in the academic world as well as in the private sector. So we're kind of transitioning into a different kind of conversation. Biopsychology, which back in the 80s when I was in college was called physiological psychology, is the domain where we're looking at the intersections between biology, thinking, emotion, and behavior. So it's really looking at the biological bases of psychological processes. Biopsychologists are going to be looking at the brain and the nervous system, the underlying biochemical processes, the genetics, all of these kinds of things that influence thinking, emotion, and action. So what kind of research topics? And really the terrain is wide open here. Neuroscience and biopsychology are really exciting areas of research at the present time. We have tools and techniques that we never had in the past to be able to look at the brain and the nervous system as it functions. We have more technologies now that help kind of look under the hood, if you will, and help us understand really complex things about human experience. So, biopsychologists can be looking at everything from neurotransmitter action and how those neurotransmitters like dopamine and serotonin are playing a role in mental illnesses like depression or bipolar disorder, or just in our regular everyday functioning. Some biopsychologists are in the specific sub-area of sensation and perception, so they'll study vision, hearing, touch, etc. Some are more focused on emotion and understanding how emotions work at a basic biological level. Some are very interested in how the brain processes language, how language is produced, what different brain areas have to coordinate to make language possible, whether it's language production or language interpretation and so on. You'll have some biopsychologists who are really interested in stress responses. Our own Dr. Knepp is really interested in these biological mechanisms in stress that are related to cardiovascular variables. So lots of different research topic areas. If you're a student who's really interested in the biological bases of behavior and you have some aptitude in biology and chemistry, but you're really interested in psychology, neuroscience and biopsychology may be what you're looking for. Neuropsychology and clinical psychology are sort of the medical application of this interest in the biological bases of thinking, emotion, and behavior. Neuropsychology specifically is looking at the connection between the brain and behavior. So, for example, you could be looking at brain injuries and how those injuries can affect cognition and mood and behavior. Neuropsychologists study anything basically that can impact how the brain and the nervous system are functioning. So you may have people looking at post-injury impacts or disease processes like the changes in the brain and nervous system for Alzheimer's disease and Parkinson's disease. Clinical neuropsychology is the practice area. where you have individuals who are going to apply their neuropsychology knowledge in a clinical setting to help people who are dealing with brain-related conditions. So, you have a person with a traumatic brain injury. The clinical neuropsychologist is going to do testing and assessment, designing treatment protocols, and in some cases, actually delivering those treatments to those individuals. Lots of research topics in this space, both in terms of the pure science of it and the clinical application. So what are some of the long-term consequences of early life experiences on brain development? You may have heard the phrase trauma-informed care. That's also extending into the neuropsych and clinical neuropsych domains as well. For example, it's been found that experiencing lots of early childhood trauma, tends to influence the way the brain develops. How do we study that, and how do we then use that to optimize treatment? In some research programs, the focus is on brain injuries and the impact on memory, attention, language, etc. Some researchers are interested in psychiatric disorders, things like schizophrenia, bipolar, OCD. If researchers can find out more and more information about the biological underpinnings of these disorders, we will understand them better, and better treatments can be developed for them. Some of these researchers are specifically interested in degenerative neurological conditions, things like Alzheimer's and Parkinson's, which affect not just cognition, but also motor skills and emotion. Some researchers are specifically interested in recovery after trauma. So you have stroke, a person has a stroke, and there is some damage to the brain. What kind of rehabilitative techniques are going to be the most useful? Some of these researchers study substance abuse, and others study things like the effects of stress and nutrition. In cognitive neuropsychology, the word cognitive there should say to you, okay, these are neuropsychologists who are really interested in the thinking piece of it. So cognitive neuropsychology looks at the relationship between, the brain and the nervous system and cognitive abilities. Cognition really focuses on memory, attention, perception, and decision making. Cognitive neuropsychologists, like other neuropsychologists, might be interested in brain injury or in chronic diseases, neurodegenerative diseases, and other abnormalities in the brain that have an impact on cognitive abilities. They may work doing research with many subjects, or they may work with individuals in order to understand their cases and share their findings with other scientists. This is primarily a research-oriented field, and many of cognitive neuropsychologists are going to be in research settings or in academic settings, pursuing basic science questions. There are some applied roles that are connected to cognitive neuropsychology, and we'll talk about those in a little bit. The major focus for cognitive neuropsychology is on how do we connect up brain structures and functions with cognitive skills, and how do we understand dysfunction and as it relates to what people are able to do, and in some cases what they're not able to do. Some research topics in cognitive neuropsych, as you might guess, looking at the impacts of brain injuries on cognitive function, looking at the areas of the brain that are active during different kinds of cognitive activities. I saw a brief report, and I really need to dig into it further, and this second bullet point reminds me of it, where they were putting people in a functional MRI machine. And they were comparing people with and without a dyslexia diagnosis in terms of, where does stuff go? What kind of activity is going on in the brain when people are reading or attempting to read? And they found some really key differences in between people with dyslexia and those without, in terms of what parts of the brain were the most active during reading behaviors. So there are lots of different research questions that you could pursue if you're interested in cognitive neuropsychology. Now, if you do have interest in this intersection between biology, the brain, the nervous system, and psychology, what kind of things can you do at the bachelor's level? Well, one thing, and we actually have a couple of graduates who came out of our neuroscience major who now work as technicians. Science technicians are individuals who work to assist researchers in the studies that they're running. So in some cases, you're talking about bench technicians where they're preparing slides, preparing substances to be evaluated and understood. So one of our former students works in a drug testing laboratory, and the kind of work that she does involves preparing brain tissue samples on slides for review by the scientists who are running the study. Science technicians keep laboratories running. They make sure that the instruments and equipment are functioning properly. They are often kind of the boots on the ground people running experiments. They may make observations, record data, and so on. Bachelor's degree holders who have a psychology or a neuroscience major, but also who are interested in this biopsych area or cognitive neuroscience area, may be able to choose those sorts of positions. In some cases, they're doing the work temporarily while they give themselves some time to think about later options. Like I've had one advisee years ago who worked for a few years, 3 or 4 years as a technician in a lab. I think it was a pharmaceutical lab, and then chose to go on and get their doctoral degree in neuroscience afterwards. So in some cases, these are stepping stone careers. In others, they are permanent careers that people pursue. Technicians typically work in research laboratories. They may be in academic environments or in the private sector. On the forensic side, there are some cases where you have in-house technicians, forensic science technicians, for example, may be employed in a forensics unit or department, doing crime scene analysis, doing blood testing, doing DNA testing, etc. There are also medical or clinical laboratory technologists and technicians. These are individuals who, and I have an advisee who went on to work in this area. I believe he works for a major hospital system and in the laboratory, and they take in samples, they do the testing and analysis. So like if you go in for a blood test and you then pull up your patient portal and you look at the results, there has to be a technician and a laboratory technologist who does that test. So that's what they're doing. They're taking physical samples. Laboratory technologists may be in a supervisory role over the technicians. And then there are also managers who are above them, and they're all going to be engaged in that work. The technicians are going to work to maintain the laboratory, prepare specimens, do tests, and so on. The technologists are going to supervise technicians and conduct all of the kind of tests that physicians order. For technologists, the expectation and requirement now is to have a certification with the American Medical Technologists organization. And even for technicians, the preference is moving very strongly in the direction of people being certified by that national organization. Now, a lot of it has to do with the organization. Say you're a hospital, you have licensing requirements for your hospital. And in some cases, there's a mandate that says your technologists and technicians in your laboratory, this percentage must be certified with a national organization. So it's moving very strongly in the direction of certification requirements. To work in these spaces, an associate's degree, so a 2-year degree, may be necessary. And then having, a 6-month supervised experience plus passing a national exam would be required. That's typically for the technologists. Technician certification, that's a little more variable, but certification is still becoming more and more necessary. As of 2022, laboratory technicians and technologists, the median salary was about $57,000. So these are solid jobs to pursue. Pharmacy technicians are the individuals who work alongside pharmacists, who they just dispense medications, give information to customers, navigate that interaction with health professionals and insurance companies as well. They can be found in hospitals, pharmacies, medical facilities. In pharmacies, there's a customer service kind of angle to what these individuals do. So they're working with patients who are getting their medications, but they're also, helping patients to navigate their insurance issues, in addition to simply preparing medications for patients who are needing them. So part of what they do is answer questions, help them locate over-the-counter medications, get information about how they need to take their medication, and so on. There are formal programs for training pharmacy technicians, and there are certifications available. In some cases, pharmacy technicians, though, are trained on the job. Some sites will say, we'll train you on the job and we'll prepare you for certification. We might even pay you to get certified. So in some areas of the economy, there's a need for pharmacy technicians. Pharmacists have been talking for a long time about how difficult it is to maintain their pharmacy techs in these positions. And part of that is because of the salary. In 2022, pharmacy technicians, the median salary was about $38,000. So in that context, it can be challenging to keep people in those positions for long periods of time. That means there's a lot of turnover. So there's some movement in the area to increase the requirements. Increasing the requirements, though, needs to come with an increase in salary. And at the moment, that's just not quite happening. Another area that can be pursued by people with interest in this area is pharmaceutical sales. And this can be a lucrative career depending on what kind of companies you're working for and to put it bluntly, how good you are at it. So these are individuals who promote and sell products like medications or medical devices to doctors and healthcare professionals, hospitals. they have to be well versed enough in the biology and chemistry, and in some cases psychology, of conditions, such that they can communicate effectively about the products that they are marketing. So, for example, if you're a pharmaceutical sales rep and you come into a physician's hospital and meet with physicians about a new antidepressant, you need to be conversant in the biochemistry of the medication, the presumed actions it's taking, the nature of the changes that you might see in a patient's mood, cognition, and behavior, also the side effects, and so on. So being a good pharmaceutical sales rep means that you have good scientific literacy. You can read the literature, the research that's built, that goes into developing a medication, but it also requires that you can be persuasive. You know, being a salesperson means that you can try and persuade people to buy the products that you are presenting to them. So there's an interesting mix of psychology as well as biomedical interest. A bachelor's degree then combined with some background in biology and chemistry are good preparations for pharmaceutical sales work. Most of these representatives are going to get on-the-job training. So it's not like you're going to find a bachelor's degree program in pharmaceutical sales. There's probably one out there somewhere, but I haven't seen it. So if you're interested in this kind of work, on-the-job training tends to start with that entry-level position where you're working under supervision and then moving up from there. There are certification programs that have emerged in recent years. So the Certified National Pharmaceutical Representative credential certifies that the person has knowledge about disease, diagnostic procedures, medical terminology, and so on, and that they are up to date with their information. So like so many other fields, we're moving in the direction of professionalization of the pharmaceutical sales workforce, and these certification programs are becoming more and more sought after. The certification requires 60 to 80 hours of self-study, so it's kind of like a correspondence course, and then passing an exam. The median annual salary, and remember what a median is, it's that middle point. The median annual salary is about $74,000. Entry-level positions are much lower. Executive positions are much, much higher. So you have to kind of look at where these positions are being offered, because salaries will differ depending on location. Neurodiagnostic technologists, this is a specialized position where people are doing tests that help physicians diagnose problems with the brain and the nervous system. Now, generally speaking, we're talking about neurological conditions, things like epilepsy, seizures, strokes, sleep disorders, and doing the testing protocols that are required to make specific diagnoses. They're trained to conduct a variety of testing techniques like EEGs to assess brain activity, testing that involves recording the magnetic fields of the brain, and a whole variety of other complex testing procedures that help physicians to do a better job of diagnosing problems. In sleep studies, for example, so if you have experienced a sleep disturbance, like difficulty falling asleep, staying asleep, or like people with sleep apnea, waking up and gasping for air, what's often called for is a sleep study. A neurodiagnostic technologist is going to be someone who's involved in that kind of testing. they may be found in hospital settings. Hospital settings and outpatient clinics are likely to be the most common places where you would run into a neurodiagnostic technician. But there are also some doctors' practices that are specialties in problems with the nervous system. Like there are entire clinics that are dedicated just to epilepsy, entire clinics dedicated just to sleep disorders. So they can be found in those locations as well. Having a bachelor's degree in psychology is considered a preparation for the job. There are some certification and credentialing programs that are popping up in recent years. And like the other areas that we've talked about already, it's becoming more and more likely that certification and credentialing at least give you an advantage in the future. They're likely to be required. Now, neuropsych technicians, and I'll be honest, I find it difficult to separate sometimes this career path versus the one we just talked about. The neuropsychological technician is going to administer tests and score tests. So the big difference between this and the last position that we just talked about is the type of test. So neuropsych technicians are more likely to be administering cognitive tests to assess functioning, as opposed to biomedical tests like EEGs or MRIs. So you're working under the supervision of a licensed psychologist to do that sort of neuropsych assessment work. So for example, if you're a parent of a child and you suspect, and your physician suspects that the child may be experiencing autism, they may refer you to an autism assessment clinic. The person who will do some of the assessment work is a neuropsychological technician. They will administer standardized tests to people to assess their functioning. Or let's say that you're experiencing some cognitive problems and you're concerned, or a family member is concerned that you may be showing early signs of dementia. You go to a neurologist. The neurologist may have their neuropsychology technician administer cognitive tests to and write a report to inform that diagnostic process. So these technicians are going to be using a variety of standardized tests. Some test verbal skills, cognitive skills like memory, attention, and language, and so on. These people can be found in hospitals and clinics. They may also be employed, although this isn't the typical location to find a neuropsych tech. They may be in schools. They may also be engaged in research either in an academic environment or in the private sector. And then finally, they may be working in a private practice area where they're working with a neuropsychologist, a psychiatrist, or a neurologist. They may work as a part of a team. In fact, that's kind of the norm. They may work with OTs, speech language pathologists, social workers, etc. Typically, these are individuals who do have a bachelor's degree in psychology, neuroscience, or a related field. And in fact, what we're seeing in more recent years is a preference for candidates with a master's degree in psychology and neuropsychology. Like a lot of the areas that we've talked about before, there's a trend in the direction of professionalization of these careers. Your authors talk about how in 2023, the median salary for such technicians was about $44,000. With the push toward people with master's degrees, individuals are going to be paid significantly more than that because the investment in education is going to require better compensation. Neurofeedback technicians primarily are going to be engaged in using EEG technologies to help individuals to understand and then regulate their brainwave patterns. This might be an area that you've not heard about before, and I'll be honest, I've never ever actually encountered a neurofeedback technician in the wild. It's something I should probably look for. These are people who, so if they've been encouraged by a medical professional to do a neurofeedback treatment protocol, the technicians may help the person by setting up the equipment, say an EEG equipment or an ECG equipment or both, and then work with them during their sessions to influence their brain waves. And some of these programs can be incredibly useful. These individuals may be found in hospitals and clinics, working with physicians and psychologists. They may be in private practice under supervision. They may also be found in research settings. They may work with psychologists, physical and occupational therapists, in neurology, and in a variety of other health-related contexts. Having a degree in psychology or neuroscience is good preparation. And some of the training that you need is actually going to be delivered while you're working. There is, like many of these other areas that we've just talked about, certification can be sought, and that may be seen by potential workplaces as an advantage, because it shows that you have the motivation to go out and seek additional training. And that concludes part 1 of Chapter 8.